Joining us now is Franklin Baker, the president and CEO of United Way of Central Maryland. And Franklin, you're also speaking on behalf of the other United Ways throughout the state, correct?
Yes.
You are here with us because United Way is out with its 2020 edition of the Alice Report on Maryland. As it was described in the report, sort of a snapshot of economic conditions across the state in 2018. That's because the report's only every 2 years, correct?
Correct, that's correct.
Tell me a little bit about what ALICE is and the reason behind this report.
Yes, ALICE stands for Asset Limited Income Constrained Employed. These are individuals who work 2 or more jobs every single day, right? And they just can't earn enough to keep pace with the state's high cost of living. We run into ALICE 2 or 3 times a day on average, right? At the grocery store, security guard, receptionist in an office building, the local diner. These are individuals who are so vital to our economy. They really help the economy to thrive. But our effort here at United Way and all of our partners is to find ways to increase their assets and reduce the barriers. Many of them artificial in nature, but to reduce the barriers for their advancement.
And to get an idea of how much we're talking about in the way of income for these families, can you give us what we're talking about here?
Yes, so the average family in Maryland, right? The 24 jurisdictions, on average, say a family of 4, right? Mom and dad and a toddler and infant. They need to earn over $69,000 per year to be outside of the ALICE threshold, right? So they're above the federal poverty level, which is a much lower number, but they're not above the ALICE threshold. So on average, if you live in the state of Maryland and you're earning below $69,000 as a family of 4, you would be considered an ALICE individual. So your assets are limited, your income's constrained, but you're employed.
And how many families fall within those parameters in the state?
Right, so right now, Sue, there are 2.2 million households in the state of Maryland, and there are 39% or about 860,000 households that meet the ALICE threshold or criteria.
Baltimore City is really impacted by this. Can you give us kind of a snapshot of how the residents of Baltimore fall into this report?
Yes, so the number is not shocking for some it is. The number, as I said earlier, statewide is 39%, but for Baltimore City is 55%, which is literally a little more than 1 out of 2 individuals, somewhere around 615,000 residents for Baltimore City. So you think about the sheer number, right? Over 300,000 of them are meeting the ALICE criteria.
And it's not spread, equitably across the city, right? There are certain areas which are impacted more so than others, correct?
That's correct. So South Baltimore, West Baltimore, sections of East Baltimore, and a few sections in North Baltimore have greater pockets of ALICE individuals and families, and certainly it's a mix. If you were to do a heat map, you'd be able to see the numbers are much more concentrated in certain sections of Baltimore. Like I said, South, portions of West, a few sections in East near the hospital, and a few sections in Northwest Baltimore.
Also, as I understand it in looking through the report, not unlike the impact of COVID-19 on communities, there are groups that are disproportionately impacted by this, much more so. Black population, other people of color, and ethnicities. Can you tell me a little bit about that as well?
Yeah, and it's not surprising to those who've been following like the federal poverty level guidelines over the years. They've been following subsidies and supports offered to communities and cities, that the same information we saw with COVID-19, the disproportionate numbers of people impacted, whether it's cases or deaths, the same applies here with the ALICE threshold. The same sort of trends of Blacks, Hispanics, Native Americans, some other Asian populations experiencing some level of disproportionality related to access to capital, access to resources, and mobility within the job space.
So you've got this information, this report from data collected from 2018, not expecting a pandemic to hit you in the end of 2019, 2020. What do you do as you go forward now?
So we sort of sit in the bunker of what we have been doing historically with this report, which is we already know the critical heat maps around what's most pivotal to focus on right now, and staring us in the face is childcare. With the the doubtful lens for the next 6 months on what will happen with schools, what will happen with quality childcare being available by geography in the state. So to figure out how do we work with the healthcare workers who have to be at hospitals, nursing homes, and other health facilities, how do we make sure they have the wraparound support, that transportation is not an issue for them, and they have available quality childcare. I actually sit on the statewide task force trying to work through the issues associated with making sure that there are numbers of available childcare apparatuses in place for these healthcare workers, especially, right? As we see ebbs and flows of numbers of COVID cases in the state. In addition to the Alice report, we also have worked with the Schaefer Center at the University of Baltimore, their policy center, to craft a benefits cliff study. The long and short of this benefit cliff study is there are many individuals who are Alice, right, where they receive a slight increase in their income. Let's say it's $100 annually, and then all of a sudden they lose up to $300 per month in federal and state benefits. So they fall into what is known as the benefits cliff. So we are working really hard with our legislative partners, both statewide as well as the federal level, to find ways to graduate the impact on those individuals that face the benefits cliff.
I'm joined by Celeste James, who is the executive director of Kaiser Permanente, one of the many partners with United Way. But in this particular case, it was critical to providing a lot of the funding for the 2020 Alice report for Maryland.
That's right.
I presume you've gone through this report several times at this stage of the game. What are your impressions as one of the partners who's trying to help United Way lift up these other folks?
Yes, so Kaiser Permanente is one of the nation's leading health systems, and our mission is to provide high quality, affordable health care and improve the health of the communities that we serve. So we are very much focused on health even beyond the doctor's office, because we recognize that health is more than what happens in a medical setting. And so this study really spoke to us because we, for many years, and this is Kaiser Permanente's 75th year this week, for many years, we have worked to address what we call social drivers of health. And economic opportunity is one of the biggest social drivers of health. If people cannot live comfortably and sustain themselves and their families, it's very difficult for them to be healthy. So the opportunity to partner with United Way of Central Maryland on this extremely important report was meant a lot, not only to acknowledging this moment in time in which we exist in COVID, but also it really acknowledged this idea that in order for people to really truly be healthy and achieve optimal health, they have to be able to live. They have to be able to survive and be economically stable. So it really just was an opportunity to present that notion that health is more than the absence of illness, and it really has a lot to do with economic stability and economic security.
So what can and what does Kaiser Permanente offer in the way of helping United Way overcome their difficulties?
Yeah, so one of the things that this report shared is that before COVID-19, 39% of Maryland households, 2 million Maryland households, were just one emergency away from being in financial ruin. So your car breaks down, or you have an illness that you have to pay out of pocket for. And there are many, many families that exist in this situation. So the Alice report is really, first of all, looking at families who remain in this kind of perpetual state of I would say, of poverty. Even though they're at the federal poverty level, they are still really struggling and continually struggling to buy and to live off the basic necessities. And so the Alice families, which is asset limited, income constrained, employed, means the working poor. These are people that we have now come to know as essential workers, the bus drivers, housekeepers, shop clerks, and so forth. So the Alice report was the first report which really identifies the existence of this working poor class of individuals. And then the benefits cliff went further to show how people who are income constrained, who are relying on public benefits, It is very difficult to come off public benefits because those public benefits essentially penalize you. When you have incremental increases to your income, even as small as $100, that can kick you off public benefits, yet you still can't afford to buy the basic necessities and maintain your family. So it was extremely important to us at Kaiser Permanente to call that out. And calling that out includes helping to identify strategies and potential policies to address this kind of effect.
How do you go about making the changes, though, that will bring the kind of improvements that you are looking for?
There are a number of ways, and Kaiser Permanente is engaged in, even before COVID-19 and for many years now, we've looked at ways to address economic opportunity for individuals and families. One is supporting small businesses. Small businesses are economic engines in communities. They bring vitality to communities. They also create jobs. Small businesses, more than any other category of business, creates jobs. And so, so we have been supporting with programs such as one called Inner City Capital Connections, which is essentially a training program for small businesses, specifically minority-owned small businesses, that help these minority and women-owned small businesses, that help small businesses to be stronger, to be more sustainable. It is a Wharton School of Business level training program that helps business, that provides coaching and training, and then helps these businesses to position themselves for capital. That's one way. We've graduated over 200 businesses through this program over the last few years, and we just launched a new cohort in Baltimore and in DC, suburban Maryland. Secondly, we even have programs that incubate small businesses. We have a program in Baltimore called Incubator Without Walls that incubated 11 small businesses in the Baltimore area that graduated them from our program so that they're prepared to lift off the ground. And these are trucking companies, barber shops, childcare. And so we're looking at ways to help our communities to achieve optimal health by engaging them around small business opportunity, job training, job placement as well, and then even working with students for college and career readiness, but going even beyond just college and career readiness and creating pipelines for jobs, living wage jobs, to Kaiser Permanente and other healthcare companies. And that's a program that we call P-TECH that we have, where we're graduating about 150 students who will graduate with their associate's degree and an opportunity to work at a Kaiser Permanente or a Johns Hopkins or other.
Now, in a perfect world, under the best of circumstances, this is a challenging project, I'm sure.
Absolutely.
Add a pandemic on top of it, and I'm wondering how sustainable it is at this point when there are so many needs out there and they're only going to grow because we don't know when this thing is going to end.
We do not. That is very true. And it's obviously COVID-19 has devastated many families and many businesses. We have heard that, I heard the other day a figure such as 40% or some large, maybe it's 20% of small businesses may not return, right? So we have, as a healthcare, as a health leader, we have an obligation to consider how we can use our influence and our resources to affect some change, to help these families, again, by delivering on strategies such as I mentioned, our ICCC program and other, and also by influencing policy. And when I say that, I am talking about the situation with the public benefits, where if these public benefits penalize families from or create disincentives is what I should say. So it's not an outright penalty, but these are assistance programs that are meant to help, but instead they harm. They keep people in perpetual poverty, because if I am a working poor family or a family member who is trying to get ahead, I might take on another job. But if it's going to knock me off my public benefits, maybe I'm going to think twice about doing so. So it's really, how do we help to change those kinds of conditions by calling it out and saying there's something wrong with this system, there's something wrong with the policies that govern this system. How can we use our influence to help to change that? That's number one. And then number two, how can we support families who are in distress since COVID and even before COVID by helping to create more job opportunities for them, helping to train small business entrepreneurs, helping to pipeline, to put people in pipelines for jobs within our own institution, helping to create small businesses that also can be suppliers for our business. We have a very strong supplier diversity program, and we do, both diverse suppliers and local suppliers, and that helps to generate economic opportunity for people in very unusual ways. And I think that's just the way that Kaiser Permanente chooses to operate, so that we aren't simply relying on our high quality healthcare to create help, but also relying on other opportunities to create economic opportunity for people.